Good evening, everyone. Mr. Cargill, Managing Director, other members of National Insurance Board, Lowe's Pharmacy, members of the media. It is every government's responsibility to provide quality health care to each and every citizen of the Bahamas. And the government today is no exception. The government spends approximately $220 million annually, though we're experiencing recession. $220 million has been budgeted for health, and the financial returns in terms of revenue return is less than $10 million. We are embarking on an infrastructural revolution so that we can see changes both at the Princess Margaret Hospital and the Rand Memorial Hospital. And we would update you with these changes very soon, which would be very, very beneficial. The new theater, so that individuals being operated upon in New Providence can be viewed and seen in Grand Bahama and vice versa, so that our medical students can be taught on the spot. Today we are here at Lowe's Pharmacy, which was the first pharmacy to sign on with the prescription drug plan to launch this new initiative, a partnership between public and private sector, so that individuals, rather than receiving their medication or waiting in line at the Princess Margaret Hospital or even some of our public clinics, can attend or visit the private sector and receive medication at the private pharmacy, a pharmacy near to them, and any to participate in pharmacy. I think this is excellent in that we would no longer see the waiting lines that we see. And I am here today to launch it and thank especially the staff of National Insurance, who have done an excellent job in putting this program together, and the staff of the Ministry of Health, and with public support. So on behalf of the government of the Bahamas, I want to officially launch this National Prescription Drug Program so that individuals can now receive their medication at all the participating pharmacies. Thank you very much.
Thank you very much, Minister. I'd like to also join the Minister in thanking the National Insurance Board's team, led by Tammy Francis and Stanley Lalter. They've done an excellent job in launching this plan and making it a reality today. So I'd now like to invite Ms. Raquel Wilson, on behalf of her children, Jonathan and Raven, to present her prescription to the Lowe's Pharmacy pharmacist and receive the first medication under the National Prescription Drug Plan this evening.
Good afternoon, Mrs. Wilson. Good afternoon, ma'am. How are you? Thank you. Yes, Mrs. Wilson, I see Jonathan is approved for these medications, and we will have them for you momentarily. Thank you. If you would just sign this for us. Thank you.
You get that pen. We just want to ask you quickly how it feels to be the first recipient, and tell us about the burden that you've had to endure paying for these expensive medications.
It feels great to know that finally we have a plan in place, whereas we can help one another. Mostly I can help my kids, and knowing that spending money weekly for 2 kids, buying one medication just to share between 2, it's great to be able to buy 2 at one time to make sure that they have enough to last.
I know that Jonathan and Raven suffer from asthma. How much does it cost you a month to buy their medications?
A month, it usually costs me $500 to $550 just to keep their medication in stock, especially in the rainy season.
So what do you want to say today as you get this receipt in hand and walk away with your medication?
I want to say thank God we finally have a relief.
The Prescription Drug Plan is a new initiative of the Free National Movement government, a partnership between the public and private sectors, providing many public patients with an option to receive prescription drugs at private pharmacies, reducing long lines and waiting periods in the public clinics and hospitals. As with most healthcare systems, the Bahamas still face many challenges. Challenges of bed shortages, nursing shortages, long waiting periods for surgery, to name a few. but the Free National Movement government has embarked on an infrastructural revolution. Changes are ongoing and will continue to be made at both the Princess Margaret Hospital and the Rand Hospital in Freeport. It is every government's responsibility to provide the best health care possible for its citizens, and the progress that this Free National Movement government has made must and will continue.